Protein needs for the older adult. Adults are living longer and longer these days, and many of them are able to stay relatively healthy. There is no secret formula to longevity. It is a combination of genetics, good luck and good nutrition that keep older adults going strong. It is essential for older adults to keep their bodies as healthy as possible to avoid serious injuries, which is often the first indicator of a rapid decline in health. In addition, a serious injury such as a broken bone can indicate potential illness. Good nutrition habits are supposed to be followed for an entire lifetime, but this is often not the case. Usually people eat bad foods until they are forced to face their own mortality, such as after the death of a peer or after they are diagnosed with an illness or have a serious injury. Some chronic health conditions are not necessarily going to be seen just because you have reached a certain age. For some, however, age is a known risk factor. Of course, that does not mean you will definitely develop these diseases, just that your risk is increased for them. Dementia, physical disabilities and other conditions can be avoided with good care, good nutrition and activity. Problems with getting good nutrition. Even seniors who would like to get good nutrition may be having problems accomplishing this task for a number of reasons. Some of these include budgeting. Seniors on a limited budget may be unable to manage the expense of a good, healthy diet on a daily basis. They may be facing days at the end of every month without any food at all. Dental issues. Some seniors may have sore mouths, be missing teeth or have poorly fitting dentures and other problems that may keep them from being able to chew foods, especially meats. Change in tastes. As people age, they may find that their sense of taste changes dramatically and that foods that they once enjoyed may no longer be appealing. The population of people aged 65 and older is more than 10%. Those who are over 85 are the fastest growing segment of the population, with an estimate that this age group will be at 20% or more of the total population by the year 2030. Source: Science Daily 2010. There are nutritional programs for older seniors. However, there are those who cannot qualify for them or may choose not to use them because of pride or other reasons. No matter why they may have problems accepting the help of these programs, it is important to realize that seniors should be encouraged to eat as healthfully as possible. Increased protein needs for the senior citizen. While the average adult may need 0.8 grams of protein per pound of body weight, the average senior citizen needs a bit more protein than that. Protein is vital for every cell in the body and for every function. It is needed in larger supplies when there is illness or injury and may also need to be increased for the older adult. Estimates for protein needs for senior citizens can be as high as a full gram of protein per pound of body weight for a healthy senior and even higher for a senior who has health concerns, including bed sores and other problems. Protein plays a major role in preventing and treating bed sores because of how it is used by the body. First, it aids the immune system, so it can help to keep the senior from needing to be in bed. Protein is also important for creating lean muscle mass, which can help prevent bed sores by protecting the bony prominences of the body. If there is a pressure sore on the body, protein helps the body to rebuild the tissue that is damaged as well. Helping seniors get enough protein and nutrients with supplements. Protein and other nutrients are so important that the American Dietetic Association and the American Society for Nutrition have issued papers directly addressing the exact nutritional needs of senior citizens plus the problems that may keep them from achieving their nutritional goals. While the general guidelines are for healthy, whole foods, the use of supplements might be advisable for the senior citizen as well. Supplements might be easier in the long run, because they are quick to consume and are more convenient for the senior. ProfectR, a protein supplement from Protica, may be one of the easiest of these supplements for senior citizens because it is small, easy to drink, and provides a solid amount of protein per serving. There are a number of fruit-based, refreshing flavors of this supplement, but if the senior is not interested in these, ProfectR can be easily mixed with food or beverages. It is heat and cold stable, so the single serving shots can be frozen and then boiled for use and can be kept out without concern of spoilage like some other protein sources. Senior citizens and protein. A case study. Arlene is 73 years old and fairly active in her community. She has always managed to stay trim and has been very healthy up to this point in her life. Her best friend Liza is not so lucky. Younger than Arlene by several years, Liza is facing diabetes and heart disease as well as dealing with several poorly healed broken bones. Her doctor tests her and finds out that on top of everything else, Liza has osteoporosis. She is convinced that she needs to reduce her protein intake, mainly because she has read information that says protein can worsen the condition. Arlene goes with Liza to speak to her doctor about a change in diet and whether or not vitamin supplements are a good choice. The doctor recommends that both women start using the protein supplement ProfectR between meals. He says that getting enough protein will help Liza to deal with some of her ailments and help Arlene to remain vital and healthy.